One of the more common questions that we get when somebody is new is when to bring a patient back. So we always want to remember that everybody has a scheduled time and we want to get them back in that scheduled time. So the only time where we're gonna really hesitate to bring somebody back is if it's in the morning and the doctor's in a sedated surgery. If they're in a sedated surgery, we're just at more of a risk of kind of things that can go wrong, and we want them to be able to focus on that. And also sometimes with anesthesia, when we are in our right mind and we don't have drugs on board our system, you can kind of reason with somebody, and if somebody's like getting really worked up, then you can kind of tell them like, let's give you a break, let's do this, blah, blah, and they can reason with you. Where if somebody has something like ketamine on board, we know ketamine can make you hallucinate, give you bad dreams, and sometimes like they'll just start crying. And there's nothing that we're doing that's wrong, and really it doesn't have to be with ketamine, just in general. So it's not that anything is going wrong with the surgery, it's just the fact that these people are having this emotional response to drugs, kind of like how when drunk people, go out, some people get emotional when they drink. So with that being said, we don't want to bring somebody back and that be what they're hearing, because the person that's coming back, they don't know that everything's fine. So we want to be cautious with that. When we are bringing somebody back, if we ask the doctor, like, hey, can we bring this person back? And they do have a patient in the room, just be mindful and close the door before you do that. So like I said, the only time we're going to hesitate is if they have a sedated surgery. In that event, let's say our 8 o'clock surgery, they're going a little bit over, our 9 o'clock surgery is here. Then we can just knock on the door. Hey, Dr. Maharaj, Dr. Pham. Dr. Pham typically won't bring back the surgery at all, but you can always ask. But with Dr. Maharaj, I'd ask, hey, your 9 o'clock's here. It's 9 o'clock. Do you want me to bring them back? And he's either gonna say yes, or he might say, oh, in 10 minutes. Or let's say it's 8:50. We can still go knock. Hey, Dr. Maharaj, your 9 o'clock surgery's here. It's 8:50. Do you want me to bring them back or wait? And he might say, yeah, go ahead, bring them back. And then that's great. You can get them connected. You can get everything started. And then you're just kind of ahead of the schedule, which we love. So we can do that. Or, he's going to say, wait, bring them back at 9. And then you have your answer. You're going to bring them back at 9. Other than the case of a sedated surgery, we're not going to wait. These patients have a scheduled time that they're going to come back. So it's best that you wear a watch or an Apple Watch, so that way you can kind of keep yourself on schedule. And just know your schedule. Like, if you know that we do all of our surgeries 8, 9, 10, 11, you're gonna have a patient at 8, 9, 10, and 11. So be looking at your watch, looking at the time, and know, okay, these people have to come back, because you need to stay to your schedule. You know who's here, you know who's coming in. There's no excuse to be, at 9, 10, and you're in the sterilization room doing sterilization, or, you're at the computer doing callbacks. You have a 9 o'clock patient and they need to come back. So we need to make sure that we're staying on time with that. So other than that, get them back at their scheduled time. Every patient, you can just bring them back, put them into the room, review things. And yeah, so don't wait. You don't need permission for every single patient to bring them back. The doctors know who's on the schedule. So the only time you're going to wait is if it's a sedated surgery. If it's a local surgery, they also know we schedule multiple other locals at the same time. We know that we're going to have multiple things coming and going. So it's okay to bring those patients back. So the next thing I'm going to talk about is